Hey there, Dr. Andrew Merrill here at Nightlight Chiropractic, and welcome to Wednesday Night Wellness Live. And this is our live video that we do every single Wednesday that helps to answer all the questions that our patients and friends ask us during the week that we hear again and again, that we want to make sure that you have the correct information for. And I'm getting a lot of questions here today and this past week about kind of what really drives me, what I like doing, what part about this kind of does it for me, because I think people can see the passion that I have for what I do. And I kind of wanted to share with you what drives me, why I come to work. It's definitely not to fight with lawyers or insurance companies. It's certainly not to go over billing and crunch some numbers with my staff. I like to treat patients. And one of my favorite patient subgroups here, and this is it for me, is disc herniations, right? So I love treating disc herniation patients that I can help to prevent them from having surgery. And this happens all the time for us here. This probably happens 4 or 5 times a month where we run across a patient that we think that we can get them well, get them symptom-free without having to go through any surgeries, right? So we want to keep them off the narcotics. We want to keep them from having that surgery. And that's my favorite group of patients. That's what I really like to do. I'm looking for these cases. And I bet you right now you're thinking about that person that you know, whether it's your friend, your family member, maybe just some acquaintance that you met one time, that is struggling with a disc herniation, right? They were told, you have a disc herniation, you have one option, which is surgery. Do you want it, yes or no? And either they said yes or no, and then the outcome was either what they expected and great, or not what they expected and not great. And that's whether they got the surgery or not, right? Basically, I guess what I'm trying to say is that there's another option, right? And that other option is kind of what we do. And so I wanted to spell out for you kind of what we can do and how we can help to give you that third option, or to maybe give that person that you know that third option. Because it's kind of weird, even the surgeons would agree that surgery should be your last resort, right? So it shouldn't be something that you go into lightly. It should be everything else has failed. Now, let's go ahead and try the surgery. So one of the other things I want to mention kind of up front here is that most patients, and I think many medical doctors, unfortunately, and I know a lot of chiropractors who do this too, they get stuck on the MRI result, right? So you get an MRI of a patient's spine, it comes back and it says disc herniation, and boop, that's it. You have to follow this algorithm, and there's no other choices for you. And what really should be driving our commentary, what really should be driving our thought process is symptoms. Right? Do your symptoms match this MRI? Because if not, the MRI is kind of meaningless. Your MRI shows that you have this horrible disc herniation, but you feel fine. There's no pain whatsoever. I mean, I'd be careful. I might change a little bit about what you're doing, but do you need any care? Not really. Go do your thing. Go. Here's your core exercises. Here's your new stretches. Here's the things to avoid. Go live your life. Good luck. And you'll also have those patients who come in and the MRI shows a very small disc herniation, or maybe even a disc bulge that the radiologist doesn't really commit to saying a disc herniation. And meanwhile, the patient has terrible symptoms. They can't feel their foot. They can't walk right because of this pain. And so, we get hung up on these MRIs and these mixed results, these mixed symptoms that go along with these MRIs, and we shouldn't. We shouldn't, right? So the MRI doesn't define what you have going on. The symptoms define what you have going on. The MRI is a piece of that. It's a clinical piece of that puzzle, but the symptoms should drive what care you're going to get. So, it all comes down to those symptoms. People want to know, well, what can the chiropractor do? A lot of people ask me all the time when I start talking about these disc herniations, well, can't you make it worse? My medical doctor said, you're going to make it worse. And if you make it worse, he can't even do surgery on me. And I wanted to go over with you what that looks like and what that means and why that's not true and why the research will support that that's not true. And I have this giant, goofy vertebrae here to kind of help to explain it to you, right? So this is a vertebrae, and then the disc, and then another vertebrae. In the front, you have that disc, and in the back, you have these joints, right? So these two joints are called facet joints, and what they do is they limit motion. So as you can see, I'm pulling on it, and I cannot pull these two bones apart. I can't rotate them as I would need to do to injure those ligaments that hold the disc together, because the joints would have to be injured first. So right there, I need you to understand, those joints limit rotation to just a couple degrees. No matter how hard we twist you, we would have to break bones before we could injure that disc. And that's what the research says in cadavers and both human models, is that you can't do it, right? You can't do it. Those facet joints limit that motion, so it can't be done. So what do we do here? So as we're doing those adjustments, the chiropractic adjustment, the old, turn on your side and crunch, click, get those joints moving, helps actually to restore normal motion there. And that normal motion helps to reduce the amount of swelling in the area, which can help the symptoms feel better because you're decompressing those nerve roots. The other thing that we do a lot of here is that flexion distraction, where we're actually pulling apart the spine, we're pulling apart that disc, we're pulling apart those joints because they'll move that way, right? They'll pull apart. And when we're doing that, we're helping to pump some blood into the area. We're helping to open up those nerve roots so that you're not feeling those symptoms. The nerve actually is not as entrapped. People think about nerves as a static, immobile thing, almost like bone. But realistically, those nerves are put together elastically, right? They stretch, they pull, and they can be compressed also from that stretching. And so every little inch, every little millimeter of pressure taken off of those nerves can help to reduce those symptoms. So we've had some great results with patients who are told by their medical doctor, they're told by maybe some other chiropractors, we can't help you. Your disc herniation is too big on your MRI. It's too big. Your MRI looks too bad, so I can't treat you. Well, that's insane. You're not treating the MRI to begin with. So here's what I'm asking you. If you know somebody who has one of these disc herniations that either they've been told they need surgery and they said no, maybe they've been told that you only have one option with surgery, maybe they got stuck in that trap of just continuing to take narcotics and medications and hoping that one day this thing is just going to spontaneously resolve and just, not hurt anymore. Send them away. I'd love to just do a free, absolutely free, no commitment whatsoever review with them, not just of their MRI, but of their symptoms. We're there in front of me, no cost. I want to see your MRI and I want to see you and what your symptoms are to see if I can help you. And if I can't, no hard feelings. Maybe you need surgery. Maybe I'm going to be the last person that says you need the surgery. They were right. There's nothing that can help you here. Symptoms are too bad. You're past that point of conservative care. Maybe you've already done conservative care and failed conservative care. Sorry, go. I'll tell you. I will tell you. But if you haven't tried that, if you haven't tried all these other steps and these other things, if you haven't tried some home care, including stretching, maybe an inversion table, which the research doesn't like, but anecdotally my patients absolutely love. If you haven't tried changing some of what you do during the day, you probably need to try that first, right? Surgery is not this panacea of health. Surgery is maybe not as dangerous as you think, but it's probably not quite as helpful as you think either. And so it should be a last resort. And I hope that you're using it that way. I hope that you're thinking about that person right now that maybe has been geared up for surgery and decided not to do it. And maybe what we could do for them. Anyway, that is it for this evening. That is what drives me. And I will see you guys next Wednesday night for Wednesday Night Wellness Live. Next week, by the way, real quick, I am having Mr. Kevin Kachin here. I'm sorry, Kevin. Mr. Kevin Kachin here with me next week, a psychologist by trade who is going to be talking with me about a variety of things, all kinds of things. We're going to talk a little bit about, is narcissism created or grown? We're going to talk about the biopsychosocial model of back pain just a little bit. Basically, we're going to talk about whatever I can get Kevin to talk about passionately, I think. Anyways, that's it for this evening. Have a wonderful evening. Good night.